Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
Hello and welcome dear students. Today is a very important class on hepatitis in pregnancy. You all have been and you've all dealt with cases with hepatitis B antigen in pregnancy. You've all seen cases dying with hepatitis E virus in pregnancy. That means you know that how morbid this thing can be, how mortal this disease can be. And in your practicals, in your Viva, even if you get a patient who is maybe an IUGR case, that is FGR case, and she's also having HBs antigen positive status, then you are going to be grilled on both these topics. So you cannot, and this hepatitis B is such a topic which is very conceptual. So once you've made the concept, you know what to answer in the examination. So I'm not going to discuss only hepatitis B here. There's a whole list of hepatitis viruses in pregnancy, and I'll be going through all these cases for you to understand properly, for you to make concepts right now. And the most important thing is I'm going to be discussing a little bit on serology in hepatitis B virus infection, because I've seen many students getting confused. And suppose if it is HBs antigen positive, what is the next step? What will you see? What does HBV DNA tell you? What does HBe antigen tell you? What does anti-HBs antibodies tell you? What does anti-HBc antibodies tell you? So today's class, I'm going to be giving you the concepts, and your fundas will be absolutely clear by the end of the class what to understand from this serology and what is the next step. I'll be giving you OSCE questions also. I'm on the way of making this OSCE bank as well, because there was a huge demand by almost all of you who've taken my classes about the practicals. It makes it easy for you to practice OSCE, and I'll be coming up with the bank pretty soon. So let's begin with the class. So let's first discuss regarding hepatitis A virus, and like I always do, I try to classify every topic into smaller subtopics. So let's first discuss about the etiology. So we know that it's hepatitis A virus is the etiological agent. It's spread through fecal-oral route. Basically, the pathophysiology in this case is the injury to the hepatocyte. So basically, this hepatitis A virus goes and causes a lot of inflammation, injury to the hepatocytes, and because of that, the liver function, it deteriorates. SGOT, SGPT, the transaminase levels, they increase. Alkaline phosphatase levels, it increases. Bilirubin, it increases, and that finally manifests as jaundice in pregnancy, and one of the causative factors for hepatitis in pregnancy. Causative in the sense, obviously, the reason is hepatitis, and reason being hepatitis A virus. It's highly contagious, but it's not so morbid. It's neither very doesn't cause mortality. It's not that morbid a disease. Of course, it's going to cause nausea, vomiting, decreased appetite, feeling of discomfort, abdominal distension, GI upset, and in dangerous cases it might cause neuropathy as well, and might even cause encephalopathy, but that case reports are pretty rare. As far as its signs and symptoms are concerned, we've covered them. Now, as far as its diagnosis is concerned, how do we diagnose it? So basically, the anti-HAV immunoglobulins, the antibodies which are produced in the body, IgM, which is immediately produced, and IgG, which when produced, it gives lifelong immunity. So once you diagnose that, we get to understand whether this is HAV virus or not. Because sometimes what happens is patient comes to you with jaundice. At that time, you have to write battery of tests. So you don't, sometimes I've seen students getting confused on what to write as the test, whether to write anti-HAV, to write just HAV and just, step away. So when sisters, they ask them that which test are you ordering? Is it HAV? What we have to get done? Is it HAV antigen or antibody? And antibodies, which antibody? IgM you want to see, IgG you want to see? That funda should be clear, that you have to order anti-HAV antibodies, both IgG and IgM. You're doing a serological test. All right. And then you get to know whether this patient has had HAV or not. So if IgM comes positive, that means she's got HAV as the antigen present, and if it's IgG which is coming positive, that is different. She could have been immunized previously also. She could have had a vaccination previously. She could have had an infection previously, which is continuing right now, because HAV, IgG antibodies, they last for life. Okay. As far as management of this disease is concerned, management is very simple. Hydration, rest, and good nutrition support. It's a self-limiting disease. It will go today or tomorrow, but till that time you have to be just hopeful, expectant management. There is no antiviral drugs to be given, and neither are they there. As far as newborn transmission is concerned, newborn transmission is already available. There is hardly any case of vertical transmission seen because this IgG antibodies, they cross the placenta and they give immunity to the neonate. So very bad cases in neonates are not found. In fact, the newborn is protected by this infection through these antibodies, which are transferred in the on the way to the newborn. With this, we finish hepatitis A virus. Let's now discuss hepatitis B virus. Hepatitis B virus happens to be transmitted through, it's a blood-borne disease, and all the secretions of the body, they have this hepatitis B virus in them, be it amniotic fluid, be it salivary secretions, be it seminal fluid and peritoneal fluid, and of course blood. So anything that gets transferred to you while you're operating a patient, the amniotic fluid comes and sits on your chapped skin, broken skin. If it comes in contact with the blood, you have a risk of contracting this particular virus. So you have to be very, very careful while you're operating on one. It's a blood-borne infection, so definitely goes through the bloodstream during surgery, with the help of, with amniotic fluid as well, through seminal secretions, through salivary secretions, so you can get easily infected. Now, vertical transmission, as far as it goes, yes, it is very much possible, and the virus is very, very small, so it can easily, transcend to the newborn. Then, when I talk about the etiology, you know that the etiology, what is the etiology? Also, you know the pathophysiology. Now, the infection of this hepatitis B virus can be acute infection, could be chronic infection, and this chronic infection can also be, intertwined with acute on chronic infection, fulminant hepatitis, and then chronic infection. If it goes lifelong, it can lead to cirrhosis, and it can also lead to liver cancer, which might end up in liver transplantation. So this is definitely dangerous. As far as acute infection is concerned, see, this is just a sudden rise of very levels of SGOT, SGPT, alkaline phosphatase, serum bilirubin, gets very, very high in these cases, and the patient obviously will present with, like I said in the previous lecture, with acute, sometimes acute pain, abdomen, distension, nausea, vomiting, especially nausea and vomiting, decreased appetite, malaise, lassitude, fever, and obviously culminates with jaundice, through which we get to understand and we order these tests. So these were the signs and symptoms. Now let's come to the diagnosis, which is the most tricky part, which I'm going to discuss in the next segment.